So lay down your burdens, lay down your shame.
Okay. So it is March 4th, 2019. We just had a session with the Dr. David R. Bersdorf.
Just a phone call.
Just a phone call. He has reviewed Carrie's medical records, all of the processes going on into the last year and a half, and to give a second opinion on things. Our expert agrees with the diagnosis as posterior cortical atrophy. Got the report last Wednesday or so, Tuesday, Wednesday.
Yeah, Tuesday.
So a little bit of processing of what.
Well, and with the report, we went to primary care physician, who had some, to answer a few other questions, knowing that we would be having a conversation today to clarify some of the things in the report. And it's been good and instructive. And it's nice that we have these resources. Many people with dementia issues don't have the resources we've been able to find.
Yeah.
Or that have dropped in our laps.
It's been a little bit of a difficult week though.
Yeah, I spent a couple of days in bed just reading, reading fluff books. So one of the things I learned today from Dr. Beversdorf, the terms of dementia and Alzheimer's get thrown around a lot, and I asked him to, kind of clarify that. And basically what it is that is going on with me is that I have a dementia, an Alzheimer's-like dementia, but it's in an unusual part of my brain. Usually it's in the hippocampus. So mainly about memory is first. But for me, it's in the front.
No, in the back.
In the very back? Okay, let's do that.
Posterior.
Yeah. Go ahead and do that. So, and that explains why it was visual things that we started noticing off.
And so it's a syndrome. The pathology is Alzheimer's, because that's if you were to be able to inspect the actual cells themselves, you would find plaques and tangles like Alzheimer's. Mm-hmm. But it's just, for some reason, in Carrie, they're presenting in the posterior lobe of the brain, as opposed to a more general or in the hippocampus.
So affecting different functions. So we do have kind of a check-off list of things left to do. So we've had several doctors with that we need to do a spinal tap, which we have joked about the fact that it really needs a different name.
Yeah.
That's a really stupid name.
Yeah.
Which some doctors really downplay it, and then we've also heard that, there can be what's the word I want? Complications that are, not very fun. But so we're going to do that. I've talked your dad into kind of a major diet change, in that there is evidence, and the doctor today confirms this, that, you know, it's solid evidence that what is called a Mediterranean diet is most helpful in slowing down the progress. So, and it's a diet, I think, it's doable. It is going to require some changes. You know, things like brown rice instead of white rice, and more wheat, more grains, a whole lot less sugar.
Mm-hmm. Yep.
But, you know, fruits and vegetables and limited red meat.
Yep.
So that's, you know, that's something we can do, which is kind of
Yep. Yeah, I agree with that.
just to have a plan of, so that we can feel like we're doing something.
What did, so when I asked what would you do, doctor,
Yeah, and that was
if it were you,
yeah.
what did he suggest?
Well, and maybe you can remember better than I. He wanted to make sure that we knew that many families stumble with issues like this because they haven't talked about it, and they don't know what the patient, what their desires or wants or needs are, and, you know, it gets to the point where the patient cannot verbalize it anymore. So they're guessing what. And along with that, I pointed out to Dad too that he's as much involved as a caregiver. I mean, it's different for him, but he is kind of a patient also, that he needs to take care of the doctor's, you know, socialness and activity and exercise and all of those sorts of things are important for anyone that's dealing with this, and to a lesser amount, our children and extended family too, that it does affect all of us.
Yep. Yep.
To different, you know, amounts. But
So having some clarity around what those wishes are, trying to anticipate what the wishes will be years down the road.
well, and setting some goals too for things that he mentioned, that things that we might like to get done.
Yep.
In the next few years. Wow.
And this is a marathon, not a sprint.
I think he indicated when he said that too, was that many people they get burned out easily because it's you know, it is a long term, particularly because every doctor we talk to, it's like, wow, your age, you know, this is really unusual how young you are for this.
Yeah. Yeah, I agree with that. He outlined that, you know, in the report he talked about measuring decline of the disease, Alzheimer's disease, on the Fulstein Mini Mental State Exam. It's a 30-point scale. That a typical rate of decline is 2 to 3 points a year.
But there's no hard and fast rule, though,
No,
either.
no, it's not. You can't. He said each patient's, you know, prologue is the prognostication. What's been going on, the rate of decline, usually for an individual person, indicates what their progress will likely look like in the future. So there is a medicine, memantine. He said you can think of it as basically it kind of pushes one back up the scale,
It resets the clock.
kind of just
6
push
months
6
is
months.
what
So if
he
your
said.
progression's been down here, it kind of puts you back 6 months.
So that's not, and it's kind of why Dr. Hart mentioned that.
He didn't seem to
Hey,
indicate,
like,
yeah, you wouldn't
no,
do that
not
now.
at your age.
Not at, well, and I got the sense more it wasn't so much about the age impact now, it's about you
saving that
saving
for,
that
for when it can be more helpful.
when it can have a bigger impact upon
Yeah.
functions.
Dad asked the doctor if he could, find that vitamin that we could take.
I suggested, please keep working on just that vitamin that we need to take
It's
to.
such a dad joke too. That's like, yeah. Wouldn't they love to just have the person that could make that vitamin would be, well,
Yeah,
yeah.
yeah. So, I mean, what's gone on? We're now, a year plus, almost 2 years since we met with Dr. Hart the first time.
Yeah.
What's your sense of your progression of it, and what's happening?
There's definitely losses. It's progressing and
Like what? I mean, what just yesterday? There was a.
I don't know. I can't remember yesterday.
Can't remember yesterday. So see, memory is there are.
No, I mean I can remember yesterday sometimes, but it's harder.
There's a group text chat for her
Oh.
service at church. that
Yeah, so
involves
I've got a new
youth.
calling with the beehives. Well, beehives,
They're 12, 13-year-old girls, right?
right? So I've got they text these little 3-word, and so I have to roll through all kinds of. What's the point, girls? What are we doing? It's just computers. The display of computers is hard, and because it moves. Reading a book, you're
It's
the
stable.
letters don't
Yeah.
move around, but
Yeah.
yeah. So anyway, and I'm getting used to getting things wrong a lot. And we've discussed some things that perhaps we could put into place now that could help
Yeah.
later on.
I mean, that kind of came out as part of this report last week. Are there accommodations? Are there things that we need to start
Because we don't want to wait until it's too late
to learn new
to
things?
learn new things. I'm afraid that it is the driving is becoming more challenging.
Yeah, she's described that she can't envision all the steps to where she's driving to when she gets in the car, even local places she's been to many times.
I can't envision what that next intersection looks like, even though I've been through it, many times. And I kind of am, what's the word for, I'm trying to, reduce the impact of that by, well, that's not exactly right.
Like you often get in the car and what do? You go to the first intersection.
Yeah, I mean, there
then-
is that. Or
And then at that point,
in big intersections, when there's multiple lanes, I really get anxiety about that. And what I often will choose, I think I'm in the right lane, and I just pray that if I have to turn, that there's somebody in front of me that I can follow. Because I'm not sure that I could follow when lanes, turn. And Texas has these all over the place. There's not very many just straight roads. They have these
yeah,
roads on the side of roads, and then anyway.
yeah, on the frontage roads and such.
Frontage roads. There's, the turning into Costco. has become my new, because it's under a overpass, and so there's multiple lanes, but all they didn't even put lines on the road. They're curbs, and there's no signs that say, like, do not enter. So anyway, it has become, that's, I don't know why. I have been starting to go around the other way, so I don't
Yeah.
enter under the, it
Yeah.
just, so little stuff like that.
Yeah.
Yeah. That it? Anything else?
Although I think we could leave it a little more of an upbeat feeling. We have more peace than our circumstances warrant.
Yeah.
Still, even with the last week, even with confronting this again
Yeah.
very directly the last week.
Yeah, it really was going all through this all over again, though.
We expressed gratitude to our doctor for taking the time, for him having worked hard over a lifetime to be able to help us diagnose, give us his experience and
Yeah.
understanding of the problem.
Well, and there are lots of tender mercies that we can see. I had a discussion with a lady at church yesterday that the fact that this was diagnosed early, it hasn't taken
The doctor
years.
said typically people go for a year before they get a diagnosis. And to be honest with you, we had
knew.
one within about 2 months of starting the process.
Right. And that has allowed us to, make some adaptations and discuss it in a different way than if we were, like with the driving. If it had been, Mom got in an accident and why did this happen, sort of, then we'd be a little more lost than what we are now, just because the diagnosis was so early.
Yep. Yep.
So, now I'm going to go buy some more cookbooks so that we can
More vegetables.
figure out, yeah.
Okay, that's probably good.
So lay down your burden.